Remember when masking was so effective for reducing the spread and transmission of SARS-CoV-2 in schools? Well, a new analysis of 16 different studies finds that there was actually no benefit from masking children. Now, you don't need to be a scientist or an epidemiologist to know that kids don't know how to wear a face mask. In fact, in my daughter's school, they were forced to wear the mask all day, but during lunchtime, they couldn't go to the lunchroom because heaven forbid they go to the lunchroom. They had to eat lunch within the classroom. They could all take their masks off for lunch and they all ate lunch together. But once lunch was over, they had to wear their face masks for the remainder of the day. This was considered science at the time. Yes, in 2021 and 2022. So kids have been wearing these masks some kids, sadly, are still wearing these masks. But we now know, this was published in the British Medical Journal. This was a systematic review of, as I mentioned, of 16 different studies. They say in this systematic review, 16 studies found no effect of mask wearing on infection or transmission, where 6 studies reporting a protective association had critical or serious risk of bias. Many of these studies were actually published by our own CDC, by the way, so it's important to acknowledge there's a lot of bias going on, and for some reason, there was a major concerted effort to force kids to wear these masks, even though we now know they did nothing for transmission or reducing risk of infection, but they had a lot of downsides. Needless to say, I actually presented at my daughter's school board. This was an e-meeting, of course, because heaven forbid you actually met in person in 2021, despite everyone getting the thing, but I presented to the medical director, the administrators, and they almost laughed at me when I said there was downsides associated with forcing kids to wear masks in terms of socialization, language development, which are talked about in this article. The children that got the most harm from the mask mandates were autistic and developmentally challenged children. We talk a lot about in policy about rising, high tides lift all boats. But what about these children? They were disproportionately harmed. It seemed like no one really cared about them. And I think that is just disappointing. And especially when you consider the fact that many of these kids, they were wearing it on their chin. I mean, when I would drop my daughter off at school, it was hanging by the ear. I mean, to think that this modality would do anything to slow transmission, especially when kids were eating in the classroom for an hour with no masks on, and then they were forced to put them back on. It's just insane to me. But we now have data, again, a systematic review from 16 different studies conducted all over the world, finding that these recommendations were not effective and were not supported by the evidence. And so I just think it's important, friends, going forward, if there ever is another viral outbreak or even seasonal cold and flu, that, we don't fall into this binary thinking camp anymore and adhere to this dichotomous thinking where, if you don't do this thing, you are the bad person. We need to apply personalization and nuance and look at the downside and compare and contrast that with the potential upside. And unfortunately, we just saw a dearth of critical thinking throughout the COVID pandemic, and we're now seeing this being applied to diet, nutrition, exercise, whether it's a plant-based diet or an omnivorous diet or what have you. We have these humans have a tendency to fall into these tribalistic network tribes where they just believe the thing without thinking critically. I think the nuance applies to a pandemic response situation as well as nutrition and diet. So please, going forward, think more critically, focus on the kids' long-term health and the potential downsides of these interventions. And again, I just share this because there was so much blowback, especially from the school board. I was incredibly disappointed at the eye rolling and the humming and hawing when I was presenting information from Oxford's Division of Evidence-Based Medicine. There's a Carl Ennigan, I believe is his name, who published a study in the Netherlands finding that mask mandates really didn't do anything to slow down the spread or transmission of SARS-CoV-2. And they just rolled their eyes and acted like I was a total idiot for even considering any downsides to these interventions. So going forward, let's think better, my friends. That's the whole point. I will link this article in the description below. I appreciate you watching all the way through. I appreciate you sharing this video, and leave me a comment if you too had similar conversations with your people in your community, your peer group, your neighbors about these incredibly insane mandates that were forced onto children. It was wild times, and hopefully we don't have to relive that anytime soon. So we'll catch you in a future episode down the road. Thanks all.